work this time. All right, can you see now?
Yes. Can you hear us?
Yes, I can hear you.
Perfect.
And can you see only the slide or my whole screen?
Only the slide. The whole screen is the slide.
Oh, okay, so you cannot see my notes then?
No.
Okay, great. So
Why?
yeah,
What
just
have you
to
written?
introduce myself. My name is Alex, as I said earlier, and I work as an assistant psychologist at the Anna Freud Center in the early years program. And today I'll give you an overview of the Mind a Dad project, which is a new service that we have set up over the past year. And we work in collaboration with different perinatal mental health services across the UK. So this is a service that supports fathers within the perinatal period, and we help and support them with the transition to fatherhood. It's a service that we set up on October 2019, and then we started receiving referrals last year. So as I said, it's a fairly new service. So today I'm just going to give you an overview of what this service is. And then I'll share with you some of our learnings so far working with the Southwest London Perinatal Team and with the dads that we have seen so far. And then at the end, I will present a case study of a dad who completed one of our interventions and some of the feedback that he shared with us. We are quite a small group, so if you have any questions, feel free to interrupt me and we can have a discussion, or you can also write them into the chat as well. So I will start with just giving you an overview of how we set up the service. So once we started thinking about this service, we realized that there weren't any other service models that we could use similar to the third sector. So we had to kind of learn very much from the beginning as we went. So we decided to start piloting the service with the Southwest London Perinatal Team at the beginning. So we kind of use the knowledge and the feedback to set up our referral pathway, get the views of what they would think fathers would benefit out of this service, and we kind of tested it with them. We also wanted to make sure that the project was co-developed and co-produced with the team, the Southwest London team, but also with fathers as well, who have previously experienced difficulties within the perinatal period. So at the start, we did set up a workshop for the perinatal team to introduce the project to them, to discuss the importance of working with fathers in the perinatal period and explain the service that we will be offering. Then we also interviewed some fathers whose partners had previously accessed the perinatal team to find out more about the specific difficulties. What was it like for them dealing with having a new baby and a partner struggling with their mental health? And we also asked them what they would have found beneficial back then, what the support would look like, and what kind of support, yes, they would like, whether they preferred something more individual or a group intervention. So bringing all of this feedback together, we started thinking of the type of the service we would offer, the marketing materials, and how we would access these dads, or how the dads would access the service. So we implemented all of this learning, and it helped us develop the name and the branding of the service, the care pathway of the service, the logistics. So we asked when and where the fathers would like to be seen, I remember back then, most of them, they were saying how they would like to access a flexible service where they can have appointments out of the working hours, so before 9 a.m., after 5 p.m., or even at the weekends, because most of them, they were working, full-time working dads. And also we used the feedback for the outcome measures that we were going to use. So we decided that we would use 5 core outcome measures at the assessment stage, once at the assessment stage and once at the end of their engagement with our service. So we decided that we would use the core 10, which is focusing on the adult mental health, the parental distress. Then we're using the brief parental self-efficacy scale, the parenting reflective functioning questionnaire, the goals-based outcomes, and the multidimensional scale of perceived social support. And as I said, yes, we've been asking them to complete these measures at the start and at the end of their engagement with us. Sometimes they complete them independently, other times they complete them with our support. This is a service.
Sorry, just a quick question. So does everyone complete all of those?
We're trying, yes, to ask everybody to complete them.
Okay. Quite a lot.
Yeah, it can feel quite a lot sometimes. So we always give them the option whether they want to complete them independently on their own pace, or whether they want to complete them with us during the assessment, for example.
Okay, thank you.
So yes, and we keep updating the service, even though we started seeing fathers a year ago. We keep monitoring our referral assessment intervention process, and we always welcome feedback from the perinatal teams that we are working with, and also the dads that they are completing our interventions, and then we adapt everything to make sure that it's as applicable and relevant as possible to everyone. So what we do, this is a service that partners of women accessing the perinatal mental health services can access, but also it's available for any father with a child under 2 who they feel that they're struggling or they need some support with a transition to fatherhood. So at the beginning, when we started working, we thought that we could accept mostly fathers from the Southwest London Prenatal Team. However, over the past few months, we have opened it up to any father who is struggling, as I said. That means that we do accept referrals from professionals working with these dads. So we have a referral form that professionals fill in and then they email it to us. Or we can also accept a self-referral from the fathers themselves via our online platform. All of the interventions and the assessments and the appointments that we offer to dads, they're virtual. So we usually use Microsoft Teams or Zoom for these appointments. And we generally follow a very flexible approach. So we do think with them when it will be best to see them, and then we offer them the appointments. These are the flyers that we have developed with the perinatal team, with the feedback of the perinatal team at the beginning. So we have one flyer facing the dad and one flyer facing the mum. These are flyers that can be shared with any families that professionals are working with. And we also have the website that I have also shared in the chat. So this is a page that we have under the Anna Freud Center main website, where you can find an overview of our project, the interventions that we are offering, and in there's a self-referral link that people can click, and then we ask them for a few details about themselves, the families, and the presenting difficulties. And once they submit it, then we receive it, and then we initiate the first contact with them. So what we offer after we receive the referral, we do offer an assessment to all dads. We usually start with an initial telephone call just to acknowledge that we have received the referral and think with them when it would be best to arrange that virtual assessment, which is often facilitated by two practitioners in our service. Usually the assessment process focuses on three main areas. So we try to think and explore the difficulties that the dads are experiencing themselves. Then we move on into the relationship with a baby. We try to understand a bit better how they view the baby's difficulties, how confident they feel as parents, and the quality of their relationship. We also try to understand their ability to mentalize with themselves and with their babies. And we also explore some any kind of possible unprocessed early trauma and active defenses. And then the third area that we try to cover during this appointment is the relationship with the partners. So after we complete this this assessment appointment, we usually take that feedback and that learning back to our team, and we have a team discussion about the case. And that's when we start thinking about the treatment. So we do think about the interventions that we are offering and which of them could be most helpful for this father at this time. And then we would normally call the dad. We would arrange a second appointment just to think with them of our recommendations and see whether they're on board, whether they have any other thoughts. And if not, if we think that what we are offering cannot be helpful at this time, we always try to signpost them to more relevant services. So for example, so far we have signposted a few dads into the local IAP services or to the local counseling services. Sometimes we may signpost them into these external services, and we can also offer an intervention within our service, so they can do both at the same time, depending on their needs and the preferences as well. In terms of what we are offering a number of interventions. All of them, they've been adapted specifically for fathers. So we do have an intervention called the video feedback to promote positive parenting, or we call it VIP in short. This is delivered one-to-one with the dad and the baby. It's been delivered online over 12 sessions. And it mostly focuses on the interactions and the relationship between the dad and the baby. Then we do offer a mentalization-based reflective parenting group, which has been the most popular so far with the dads. So this is a psychoeducation group delivered over 7 to 8 weekly sessions online using Zoom for an hour and a half. And we keep the groups quite small, so we usually have 4 to 7 groups, 4 to 7 fathers per group. Then we do have some limited capacity for parent-infant psychotherapy, which is a bit longer term, and it's again an individual type of therapy. We have a clinician in the service who can offer up to 24 sessions. Then we have also included more recently some low-intensity CBT for some of these fathers, which is up to 6 weekly sessions. And currently we are also working in the development of an online resource hub where we will be offering some self-help resources to dads. So these are resources that we are co-producing with dads for dads. And it includes a wide range of resources. So we have some podcasts, some videos, and some blogs as well, and it will cover a range of topics. So we have resources on managing a full-time job and having a new baby, for example, having a partner experiencing mental health difficulties, coping with lack of sleep at the beginning, coping with postnatal depression, and a range of other topics. We are working in collaboration with another organization who is helping us develop that online platform, and we are hoping to get it out during the summertime. So this is the service. This is how we work and what we offer. I don't know if you have any questions around that so far, around the referral process, who we see, any exclusion criteria before we move on.
I had a question, Alex. Somebody asked about how old for the children, at what age, basically. And I know it was 1 year. Is it still 1 year?
It's 2, so we can
It's
see
2.
any father with a child under 2.
Okay.
Can I ask about the virtual appointments? Was that something that came out of your talking consultation with dads, that they preferred that, or was it just COVID related? And out of lockdown, would that stay the same? Would you have face-to-face group, or were there feelings around that?
So when we set up the project, that was before COVID. So our initial plan was to deliver the service, all of the appointments face to face into the local community. However, due to COVID, we had to adapt everything online, remotely. And as we were delivering the service remotely and hearing back from fathers who have accessed the service, we realized that they really found the remote delivery quite helpful, and they really enjoyed it. So we've decided to keep it remote even after COVID. So this is going to be a remote service which will give access to fathers from across the country. So we have expanded the service nationally. So lately we've been working with perinatal services in St. Helens, for example, Northampton, and other areas out of London. So yeah, we'll keep everything remote.
One last question. The resource hub, when that's ready, would other agencies be able to access that, or is it just for your dads there?
That's a good question. The resources that we have already put together, they are resources facing the fathers themselves. So it will be directed to fathers. However, I'm not sure how it will work, whether other professionals will have access to it and they may, for example, copy and paste the link to that to the clients that they're working, or whether they would have to refer these fathers to us and then we will have to give access to them to the platform. I'm not quite sure yet, but we'll keep you updated. Once this is ready, we'll communicate that with everyone.
Okay, thank you.
There's a question from Lee. Lee, do you want to ask it, or shall I just read what you've written?
Yes, please. Thank you.
You want to read it? Lee's asking whether you offer support. So does the father need to have suffered from mental health difficulties in order to access the service?
No, so the project, the service, is for any father who is who can find it difficult having a new baby. So we have had fathers in the past who found it really difficult adapting to this new era in their lives. Fathers that they found it difficult understanding the baby, managing different responsibilities, and having a new baby, or a partner who is finding difficult as well. So it's not only for fathers experiencing mental health difficulties.
Well, thank you. What about for father who maybe refuse to believe, have difficulty, even just like father believe they can do well, but then the partner who with things benefit from access your service? How? Well, I just wonder, has any your any user in your service has anyone come across that? How do you support those? I mean, I just wonder.
Yes, so we have worked with closely with the perinatal team, who mostly works with with the mothers, and sometimes we have come across you know mothers that they thought that the partner would also benefit from some support, and that's why we have created that flyer facing the mum as well. However, um, we would like when we would like fathers that they're aware of any possible referral. For example, we want fathers to consent to the partner or any professional referring them to our service.
All right, I see. Thank you. Thank you.
Thank you.
Great, thank you, Lee. Back over to you, Alex.
All right, so I'm just going to move us into what we have learned so far. Firstly, working with the perinatal teams, and then working with the fathers. So in terms of working with the perinatal teams, we have one of the first things that we've learned and we've noticed is that the simpler the referral process, the better. So perinatal teams can be quite busy with large caseloads. So we wanted to make sure that the referral process to our service was as easy as possible, and the form that they had to complete for our service was very easy and accessible as well. Also, from working with a large multidisciplinary team such as perinatal teams, we thought that a very useful way is to set up project champions. So these are people that they're working within the team, that they are responsible for disseminating the information and processing our updates to the wider teams, keeping the colleagues engaged and updated. We are also very much led by the perinatal project champions, or the leads in the service, on what they think will work well to engage the teams. And this involves sometimes members of our team attending the team meetings, helping and supporting perinatal staff members with any questions they may have, any ideas, troubleshooting problems, and keeping them engaged with our service. Also, another very important learning for us was the importance of engaging with a wider local network, working with fathers. So that includes working closely with health visitors, midwives, GPs, IAP services, Home Start, and other third sector organizations and charities in the local area. So this has helped us reach a larger pool of fathers and get our names out there quicker. Yes, so that was kind of a summary of our engagement with different teams. Then in terms of our learning working with fathers, these are some of the key points that we've noticed so far. So first, we always try to keep an open door policy for dads. So we have noticed that it can be quite difficult to reach and engage with with fathers. So for this reason, we try to be very flexible in our approach. We have very few exclusion criteria, and we try to see all fathers pretty much with a child under 2. As a third sector organization, we are able to pick up referrals and set up assessments very quickly within a few days of receiving the referral, and also offering the interventions quite quickly after that. So when we did those interviews before setting up the project, all fathers, they have fed back that they didn't want a long wait between their assessment and receiving the support. So we tried to implement that and keep it in mind. So whilst, for example, we are holding a dad in our caseload for the next group that we may offer, we do keep them in mind, and we may give them check-in calls quite regularly so that they feel connected with us during that waiting time, which has helped quite a lot. Something else that we've noticed and we've learned is around the language that we use when we're engaging with fathers. So we thought that we keep our language quite simple when we're interacting with them through emails, telephone, or our marketing materials, or our website as well. Due to the stigma that many dads have experienced during this period, we keep our language very light, relaxed, non-medical. So for example, when we talk to them, we may tell them at the beginning in the initial call that we want to see them for an initial appointment to have a chat with them, find out a bit more about them, rather than we want to have an assessment with you, for example. Other small learning points around language was that we try to use non-medical language, so we don't use the word therapy. For example, we may use the word support, so we won't provide some online one-to-one support, for example. We also want to keep our language solution focused and normalize why we're asking detailed questions in the assessment questions, and also to reassure them that these are questions that we ask everyone, for example, at this point. Also, another key learning was around the support and the engagement from the referrer and the partner as well. We have learned that often fathers will need consistent encouragement from the professionals who are referring them into the service, or even the partner before accessing the service. As I said earlier, this is why we created that flyer for the mums, to encourage them to think about their partner and discuss with them, think with them whether they need some kind of support, and if so, to encourage them to access our service. Also, the opportunity to self-refer was something that we thought was quite important due to the barriers that these fathers experience when they try to access services. We really wanted them to feel empowered to access the service themselves online. Then another thing that came up quite a lot on the feedback that they have provided us so far is the online delivery of the interventions and the assessments. So most of the dads who completed our interviews after the interventions they attended, they mentioned how they really enjoyed having the appointments online and how flexible that was for them, which allowed them to keep up with their work, the childcare, and the household chores that they may have to complete. For example, saving them a lot of time from traveling somewhere for these appointments. And also another very interested learning from the engagement with them was their preference for a group intervention. So we do offer, as I said earlier, a range of interventions that they are one-to-one, but we also have a reflective parenting group that we can offer to them. And most of the fathers that they've attended an assessment with us, they told us that they preferred that group intervention, and we thought that they wanted that because of the isolation that they may be experiencing as new fathers. But also during the lockdown, a lot of them said how isolated and lonely they felt because of the restrictions and the lockdown and everything. So getting the opportunity to meet other dads experiencing similar difficulties was quite empowering and helpful for them. And they also enjoyed the fact that they were able to talk to other fathers that they struggled with similar difficulties. So some of them, even if they had a network around them, they had some friends, for example, they felt quite lonely in the sense that they were the only parents or they were the only dads with a partner struggling as well. So having the opportunity to meet other dads in similar positions was quite liberating for them. And then the other helpful element around the group work was the openness of the group. They felt quite empowered, as I said, to share their thoughts and feelings in a non-judgmental space, which was quite important. Now moving on in terms of our virtual assessments, these are some of the learnings that we had. So the first one, which is quite obvious as well, and it's quite common when we work therapeutically with any client, is around the Therapeutic Alliance that we built, which we thought there would be a struggle doing it online, via Zoom or via Teams. However, we've noticed that we did manage to build a therapeutic relationship and alliance through those online meetings. And we started that process of building the relationship with them from the very beginning. So once we called them to arrange that initial assessment appointment, it was really important to make them feel relaxed, open and comfortable to talk to us. And then when we got to see their face in the online virtual assessment, it really helped us explore some of the difficulties and the problems. We also found that many of these dads reported that it was the first time that they have talked about the problems with anybody else, and due to the feeling that there isn't any other space for them in the family to share some of these difficulties. We were also concerned that meeting them for the first time online would mean that we wouldn't be able to gauge how they were feeling throughout the process, and it would impact our relationship as well, which it didn't happen really. As I said, we tried to make them feel quite open and non-judged throughout these assessment appointments. And then the other thing was around the outcome measures that I also mentioned at the beginning. So we thought a lot of how we could help them engage with these outcome measures, because they can feel quite a lot. There are 5 outcome measures with a lot of questions. So we always gave them the opportunity and the chance to think whether they want to complete them independently or they want to complete them with us. Most of them, they told us that they wanted to complete them independently on their own pace. So we started using an online platform called Pod, which is a tool that we set them up, then they log in there before the assessment at any time, and they can complete these outcome measures anytime. So that means that they can start with the core 10, complete it, save it, and then come back to the rest of the questionnaires a bit later, for example, which they found quite helpful. Then in terms of our interventions, one of the main learnings is the importance of working with what the dads bring. We streamline and adapt our offer as we go according to what we learned from these dads and the problems that they're bringing into the sessions. So for example, we started at the beginning offering a couple of these interventions, and then we soon realized that we wanted that the fathers wanted more. So we added the low intensity CBT as one of our offers, because we recognized that many dads who were accessing the service, they wanted help and support with their own mental health, apart from their engagement or the bonding with a child. So a lot of them would experience low mood and anxiety themselves, on top of struggling with managing a new baby, for example. So whenever we can, we signpost fathers to other services, including IAPT, who can provide CBT, for example. But there have been cases that we thought that keeping them within our service, because we have already initiated some kind of relationship with them, would be more helpful for these dads. So we do offer some low intensity CBT to some of these dads, rather than signposting them elsewhere. Also, we have found that offering dads support for their own difficulties sometimes can act as a bridge to prepare them for working on the parent-infant relationship. So once a better understanding of their own mental health has been achieved, then we can move them into thinking about their relationship with a child, and we can offer them something a bit more exploratory, like parent-infant psychotherapy. Many fathers have come into our service wanting help with how to support and relate to the partner. So we have also added some more couple-focused programs in the project. So for example, in the reflective parenting group that we are offering, whilst it's a program that it helps fathers to mentalize themselves and the babies, we have adapted it further, and we have put a strong focus on how to mentalize their partners as well, so that they improve family dynamics and the overall relationships within their families. And
Got
then
10 minutes, Alex.
all right. So I think these are some of the main kind of learnings that we've put together. So I'm just going to move us very quickly to the last part of the presentation, which is a case study. This is a dad that we have seen in the past. He has engaged with us in the assessment process. Then we've seen him into one of our groups. And at the end, when he completed that, he gave us, we offered him an interview with one of our evaluation officers, where he had the opportunity to share some detailed feedback of his experience with our service. So this is a father who presented with a range of difficulties. So his partner had experienced postnatal depression. They experienced a traumatic pregnancy and birth, and that resulted him feeling quite upset emotionally under a lot of pressure, quite depressed, and there were a lot of changes in his relationship with his partner, and also that impacted his engagement, bonding, and attachment with his baby. So when we saw him for the assessment, he had told us that this was the first time that he was thinking and verbalizing those difficulties, and this had been the first time that he was sharing these problems. When we talked with him during the assessment, we've noticed the difficulty making those links between his own mental health difficulties and the impact of them on his relationship with the baby. So at the end of the assessment, we kind of put together a few goals that he had for therapy in a very collaborative approach. So what he had told us back then was that he wanted to be able to support better his partner, understand his partner better, understand his baby better, whilst being able to improve his mental well-being as well. So taking the case back to our team, we thought that the group intervention could be a good option for this dad, because it would give him the opportunity to think about his own mental states, his own feelings and thoughts, whilst exploring and understanding a bit better his child's and his partner's thoughts and feelings. And at the same time, we thought that it would be really helpful for him meeting other dads that they were going through similar difficulties, share some of his concerns with them, and at the same time learn from them regarding those difficulties. And indeed, he did engage with the group quite well. He attended all of the sessions. He completed the outcome measures at the assessment and after the intervention, and he told us that he generally found the sessions quite helpful, and he had improved quite a lot, which was also reflected on the outcome measures following the intervention. So some of the feedback that he shared with us was that he had gained quite a lot from the program. He said, "Oh, I think I'm going to be a better dad for my baby," and that was the only thing that he could ask for at that point. Although he hadn't recognized the need for a parenting intervention to help him with his baby specifically at the beginning, he thought at the end that that was really helpful, and he learned quite a lot from the group. He also find it quite interesting learning about mentalizing and applying the mentalizing approach into his relationship with his partner, because that made him feel more understanding towards his partner's difficulties, and that brought a better balance in the relationship. What he found particularly helpful was that he was able to take a step back when he was in the middle of a difficult moment with his baby or his partner, think about how he was feeling during that moment and how he could respond to the situation better. He also rated 10 out of 10 of how enjoyable the sessions were, and he also really enjoyed the online aspect of the service, because that helped him save a lot of time. It was very convenient in terms of his time management, and yeah, overall the feedback was quite positive. And Yeah, some of the suggestions and the changes that he recommended was that he wanted to get to know the other members a bit better. So a disadvantage of the online delivery is that people miss the opportunities to speak to each other out of the sessions. So usually when we see people on a face-to-face group, people would meet each other before the session. During the session, when we have the coffee break, people have the opportunity to chat a little bit, which they didn't during the online group. So what they recommended, this dad recommended was that they had like 10 or 15 minutes after the session, maybe in the Zoom call, just them, just chatting about anything really. And this is something that we have started implementing on our last group. So we would myself and my colleague, we would end the session and we would leave the session, but we would let them stay in there for as long as they wanted. And then he also told us that he would have found helpful if we included the partners into the group. So this is something that we are thinking for the next group that we are going to deliver, whether we can have a couples reflective parenting group. So we think about it right now, how this could work. So yeah, these were some of his recommendations, and that's the end of the presentation. As I said, the next steps of our service is to put together that online platform, which is going to happen over the summer. Then on January 2021, we're going to have a big kind of celebration event for the project. We will publish our evaluation report, and we'll be happy to share it with any professionals working with fathers, but also any families, any fathers or partners that they want to attend, and we will be sharing our findings and our experience rolling out that service. Also, we have an early years conference at the beginning of June, on the 9th of June, which is mainly for professionals working with families and children under 5. And we will also do a short presentation on fathers' mental health. So if you're interested in hearing further about our work, you can join that conference. And I'm just gonna stop sharing my screen now.
Great, thank you, Alex. That's
Thank
really
you.
interesting. And I'm echoing here. I don't know why.
I was just going to ask, is it able to send a copy of the slides?
Yes.
Okay, that would be great. Thank you, Alex.
I will send around a copy of the slides, and then I can also send the flyers of the service and attach you the link to our website.
Okay, thank you.
Brilliant, thank you. That was a really good session. I'm echoing, and I'm really sorry. I don't know why, but I just wanted to, it was just so interesting to hear what the fathers and partners were saying, because we don't often hear their voice. We assume, we think we know what they're thinking, but actually for them to really break it down for us has really been helpful as well, because we need to think about how we tailor our services to meet their needs as well. So it's been good. Yeah,
I agree. And we also found it really helpful hearing from them and adapting our practice and our service to them. And I think it's going to be really interesting putting everything together towards autumn time, summarizing all of the feedback that we have and putting it into that evaluation report together with the outcomes as well.
Yeah. And is the project is it going on for longer, or is there an end date?
I'm not quite sure yet. Initially, we were meant to complete the project on March this year. Then we had some more funding for September 2021, and I think we have asked for a bit more funding now. So I'm not quite sure whether we will have a further extension or not yet, but we'll keep you updated. Yeah. So in a way, does more referrals kind of help
in order to justify being able to keep this going and reaching out.
Definitely, at the moment we're open to more referrals. We just finished one group couple of weeks ago, and we're in the process of getting feedback from these dads. At the same time, we're assessing other fathers for the next group that we will be starting in a couple of weeks' time. So if you have anyone in mind, feel free to refer them, and we'll have time to assess them over the next couple of weeks. But even if they don't make it into the group starting at the end of May, we will consider them for the group, for the next group after that, or the one-to-one interventions that we are offering.
Okay, great, thank you.
Just ask
Ingrid,
about
yes.
this team. Is it a mixed team, male and female?
Yeah,
Or-
so we're a very small team. But yeah, it's a bit it's mixed. We have it's me and my colleague Abel that we are working, and then we have 3 female therapists as well.
But, how important do you think it's been that there is a male included in the staff team there? I think that's been significant.
It's an interesting question because we did have groups that they were facilitated by a male and a female therapist, and we also had one group which was facilitated by 2 male therapists. So that was a, you know, all male group, and a couple of the participants noticed it, and they gave us some feedback about it, and they said how they felt that that was quite helpful for them because they felt more kind of open in a way. However, there were other fathers that they said that if there was a female participant or a female, facilitator, there wouldn't be any problem. They would be equally helpful.
And
So
in terms of
a
your
bit mixed.
thank you. In terms of your self-referrals, how successful was that, as opposed to ones that came from professionals?
Yes, at the beginning, the first few months, most of our referrals were coming through the professionals, but as we go by, we've noticed that the self-referrals increase quite a lot. So I think that people find it really helpful having that flexibility of choosing to self-refer, and they find it quite easy, I guess, to do it themselves because it's a very simple online form that they have to give us some of their details, and they can also write a few things about themselves. So I guess choosing what to put in there can be quite helpful for some people.
Yeah, that's great. No, it sounds like a great project, and I've certainly got a dad in mind to refer on.
Thank you. Yes, if you have anyone in mind, you can either send the referral through, but if you're not sure, you can always contact me or my colleague or the other team, and we're happy to have a chat about every referral.
Great.
Thank you.
That's one more referral coming your way, hopefully. Which is good. So yes, we've come to the end now, and I just wanted to say thank you to you, Alex, for kind of sharing all that with us, and also to everybody who's come today and joined us. Yeah, it's been a good session. Thank you. Any other questions before we finish? No. Okay. Great.
Sorry, Aki, I was just, can I?
Yeah.
Sorry, no, just going to jump in quickly there, Alex. I found that really useful. Obviously, being communication for the trust. I think especially if you've got that end of May deadline, it'd be really good if you want to send me across the flyers and stuff that we can look to get that out to some of our partner organisations and really push. Because I'm not sure how many people, like I said, are aware about the support for dads. I think we push obviously the support for mums. But yeah, I've learned lots in that session. So thank you very much for that. And yeah, more than happy to support you to promote the service and get those referrals in.
Thank you. That'll be really helpful. I will make sure that I will circulate the materials.
I've got the flyers, Emma. I can send them to you as well as the referral.
Thank you. Thanks, Aki.
Brilliant. Hopefully you're going to be inundated. Oh, okay.
And it's been great support from you, Aki, and your team, because we we set up and we built that project with very close collaboration and connection with you and your team, and you're really, really helpful.
Oh, thank you.
I have to say that.
I think everybody's worked really hard because I think we all feel passionate about it. We all want to make a difference and help our families, really. So it's an excellent opportunity that we didn't want to miss. So great. All right. Thank you, everybody. Have a good day. We've got another session. Shireen, what time is your session? Sorry. 2 o'clock?
It's at 2 p.m.
2 p.m. And you're talking
with
about
myself, with Amit and Jordan, and we will be discussing the circle of security.
Intervention. Brilliant. Thank you. And then at 3 o'clock, it's just to check in with our team if anybody wants to come and say hello to us as well. So come and see who we are. Great. Okay. Thank you.
Okay.
I'm going to stop recording.
Thank you very much.
Thanks, everyone.
Thank you. Bye.
Bye. Take care.